Welcome back to the Context Coaching Podcast. We are blessed to be joined by my guest from down under, Jorden Radliff, who is a physiotherapist based out of Melbourne. Looking forward to talking about this and learning more about ACL recovery and all things physiotherapy. Thanks for taking the time to join me today.
Justin, thanks for having me, Matt.
Hey, let's dive in here. So you mentioned you grew up on the Gold Coast. You were into sports growing up. Can you take us through your background, both as an athlete and when the proverbial ball stopped bouncing, which led you into a degree in exercise science and physiotherapy? But would love to know more about your specific sport background.
Yeah, that's right. I grew up on Gold Coast, Australia. My dad was actually American and he got us into sport pretty early. He came over, played professional basketball for a long time, so we're always around sport. So that's where it started. So I was playing basketball, I was playing baseball. Dad was a coach at the time, but I then ended up playing a lot of soccer. And for some reason, soccer was my main sport. And that took me through all through primary school into high school. And I ended up going to college in Kentucky for a couple of years playing soccer, which is really fun. And that's where I started to think about, all right, maybe I'm not going to be a pro athlete here, but I want to be involved in sport. So after 2 years, decided to head back home and start to study. I did my undergraduate in exercise science at a place called Griffith University on the Gold Coast, and then went into a master's of physiotherapy. So I probably stopped playing sport when I was ending that undergraduate, where I knew through that master's of physiotherapy I'd take it a little bit more serious, and then we dived into that.
Where in Kentucky? What school?
It was called Pikeville College. It's NAIA,
Yep.
and it was fun. I met a lot of good people. Probably wasn't the best. We didn't have the best soccer team, but we were versing a lot of schools that had a lot of internationals and a lot of good teams. So that was really fun as well.
Can you do me a favor and give me your take on, to the extent you can, right? The difference
Yeah.
between the Australian sport experience and the American. Because coming here and playing college soccer is a completely different experience to what y'all are used to there with the club system and the representative system. And I'm always curious what each of my Aussie guests' take is on those schemes. Can you give me a little bit about your feel on that, what you learned, what you appreciate about each?
Yeah, definitely like for us, school sport isn't really a thing. Growing up, going through our primary school and high school, like you play some school sport, but it's for one semester, so one term, and you're not really training. You're just going to play different schools every now and then. So it's not really taken seriously. So that's probably the biggest thing I reckon from the States to Australia is the school system. We don't really have anything. We don't go to the gym. We don't really have gyms like lifting areas at the school. It's more just you going out and having fun. But I guess where we focus on a little bit more is the club scenario. So everyone goes and plays club sport. If that's basketball, if that's football, if that's soccer, whatever, they spend a lot more time at their club rather than doing anything at school. But saying that, it's only done 2, 3 times a week, and at a level compared to states, it's different. It's not developed enough. Strength conditioning, we don't really have that in our schools or for our young kind of athletes coming through. It's just very underdeveloped to what I was exposed to when I went to the States, where we were lifting every day, where we were training every day, where we were traveling so much. It was more I was moving into a professional environment compared to just a fun environment.
And how does that align with your work as a physiotherapist if you're saying that there's not really a culture of the gym or strength training or those things? And how do you see those kind of marrying since you had that exposure to what you're living with here? Like, what's the appropriate balance as you see it now as a professional?
I think it's coming because that was in 2008 and 2009. So I reckon it's changing quite a lot. And we're definitely far behind the States in regards to athlete development and progressing our athletes through, but we're moving in that right direction. We've got a lot of physios now that have an S&C background. We've got a lot more S&C in schools. So I think we're progressing in that right direction. But from me seeing that and a lot of people being exposed to that, because a lot of Australians are heading over to the States these days, but we're starting to slowly catch up and implement that. Australian rules football, AFL, is probably one of the biggest sport, and rugby league is as well in Australia. And they're big contact sports, so they involve a lot more strength conditioning coaches these days and putting a lot more work into it. Same with probably basketball and soccer slowly coming behind that. We're trying to get a little bit more strength involved in them as well.
So when you transferred back to Gold Coast to the university there after spending 2+ years being a student athlete. What was that
Yeah.
shift like to being just a student essentially when you landed and you're like, okay, this is what I'm pursuing now?
For me, I think it was good because I was at the time where I was like, okay, I want to learn, I want to get a degree. And I felt like when I was in the States, I was more of just an athlete. Like I was there to play and then school was a little bit of whatever. I got the classes I need to take and it wasn't any more than that really. So I think coming back to Australia, it was like, okay, my whole focus now is let's do my undergraduate and then let's get into my master's. It was a little bit challenging because I didn't play as much sport anymore, but at that point I knew that I wanted to get into being a physio, and that was my sole focus there.
The other thing I'm curious about in my takeaway, and correct me if I'm wrong, was that in Australia, the culture seems to be you stay close to home for university, where here you usually go away. What was
Yeah.
that like going super far away, but then coming back and you basically did your undergrad and your graduate program in the same area you grew up in? Am I right in that assessment? That's what happens, or am I delusional?
Yeah, yeah. For a lot of people, it is. If you're trying to get into a certain med school or whatever, that may change. But for most of us, yeah, we stay at home. Like I moved back into my parents' house after living on campus for two years. So it was definitely different. But yeah, that's what we do. There's not as much of, all right, we're trying to get into this or get into that. We're just getting into the university close by. Yeah, so it's very different, especially if you're living at home with your parents.
Yeah, my cousins that my side of the family's in Perth, and so my cousins basically are in a similar situation. They go to the one of the local universities there versus going to somewhere else to go to school, and I was surprised by that, but it seems to be the norm. All right, diving into the difference between, say, an exercise science undergrad and a physio master's. For kindergarten version, can you break those apart for me? And the reason I'm curious is one of my former players spent 2 years teaching in South Africa, and he called me and we need physios in the United States. We don't have them. All this
Mhm.
therapy stuff, it doesn't treat anybody, but the thing that physios do are completely different. So can you tell me to just break it down for me?
Yeah, so exercise science is more of it sets you up for what you're going to go into next. So it's more of a gateway type, pretty broad undergraduate where you learn everything. You get into your biomechanics, you get into your chemistry, you get into your biology, you get into yeah, all that type of stuff. So you're setting yourself up for what is next. If people just finish at I guess, an undergraduate of exercise science, they'll end up going into more like strength and conditioning, or they'll build into that. Some people go into dietetics, some people go into speech pathology, occupational therapy, or go into EP or physiotherapy. So your undergraduate is more of getting your knowledge, getting your background, and taking it from there. A lot of good S&Cs coming from an exercise science background end up being quite good in regards to their stats as well. They got really good GPS related stuff that can come out of it. So that more sciencey strength and conditioning coach can come out of an undergraduate of that. But for me, it was that lead into what's going to come next. So it gave me a good background, but then it pushed me into, all right, now I can go into my master of physiotherapy and dive deep into that area.
And how would you describe physiotherapy in layman's terms relative to, say, what our knowledge is over here of physical therapy slash rehab? Like, how do you describe that?
I think broadly it's probably very similar in regards to the basic parts of it. So physiotherapy is more we're focused on the anatomy and the physiology of the body and how it works and how do we treat certain injuries and get people back to sport. So I think broadly it's very similar, but I think our thinking systems and how our mentors have taught us certain ways are probably different in Australia compared to the States. And I think our also the way we can set it up with our public and private is probably very different to how it's run in the States as well.
Yeah, no doubt. Okay, so controversial question. What are the things that you're aware of in the States that as Aussies, you guys are just like, yeah, man, that's wrong. You need to stop doing that. Because again, when we were there, I saw somebody for myself, and then my player and the dad saw somebody, and it was just like this eye-opening, like, why don't we do this back home? Give me quick sound bite that you may or may not have just on, yeah, this is the standard over there, and this is where we put our energy and where we found some success.
I don't know. I don't know heaps about like the physical therapists in the States, but it's what I know is it's challenging to get into see a physical therapist. Like it's quite expensive, and I think here it's like our Medicare system and our private health is very good that allows people to spend a lot of time with their physiotherapist. If they're going through an ACL rehab, I can see my athlete 2 to 3 times a week at a cost-effective price where I can get them running through that whole rehab for as many sessions as we want. There's no, all right, you've got 6, 7, 8 sessions and then you can't see your physical therapist anymore. In Australia, we're able to spend so much time with our athletes, and that's where I believe we do get success, especially in these longer term rehabs like an ACL. So potentially that could be the biggest thing there is how it's set up and how we can push our athletes for success rather than just, I guess, trying to make money or whatever it is.
That makes sense. That makes sense. Okay, so you are essentially an expert in the ACL space these days from a rehabilitation standpoint. How did that come about?
It's like I moved straight to Melbourne from the Gold Coast and I just wanted any job to start with. So I worked in a private practice. I was seeing a bunch of different clients. Every consult was 30 minutes. So you're just going back to back. I was seeing 50 people a week, which is quite a lot for us. And I just didn't love it. So I was like, there's got to be more than this. And I met a guy in the strength conditioning world called Christian Woodford. He did a bit of time in the States as well at a university. And he's like, come work with me. So I ended up working with him. And because he was in such an athletic population, he would just be sending me all these knees. And this was about six years ago now. And then I had all these knees that I had to try and figure out exactly what to do. And that's where I started to dive deeper into this ACL world because they're all ACLs where I could treat them in the rooms for as long as I wanted to because it was my place I was setting up. I could be in the gym. We had a really good gym and then we had a field just down the road. So I started to set up this space where these ACLs could be successful. And then we just started to get more and more because they were sick of going to a traditional physio where they got 20, 30 minutes every couple of weeks to being able to see me for an hour and then push through that way. So it started like that and then word of mouth just started to come through. And now I just keep seeing ACLs and ACLs.
Okay, so let's dive a little deeper then. What in those 6 years that you've become so well versed in this, have you discovered? And I know you can't generalize because everyone's so unique, but I'm going to ask you to generalize. In your personal experience, is the incidence up or down? Are there risk factors that you can name that seem to be prevalent? I'm just real curious because anecdotally, I feel like they're up because of sports specialization and that having its impact. But I'm also throwing darts and trying to support my own narrative. What is your actual take on where we are in the grand scheme of ACL injuries, rehabilitation from them, prevalence, risk factors, etc.?
Yeah, I definitely think it's going up. And I think it is, it's probably so many things. You're probably right in the specialization. I think that's a massive one because having kids and having younger athletes just playing multiple sports improves their coordination, gets them going in so many different areas, and there's not that massive repetition on the same thing all the time. I think that's definitely one. I think speed of games, volume of games is a massive one as well. And I still believe, especially in Australia, these younger athletes, if we think about prevention a little bit, there's not enough focus on the gym for a lot of people. It is just playing their sport, especially soccer players. Soccer players are the hardest to work with because they've never been in the gym before. And then when they do get injured, it's starting from fresh, where some of these other athletes do have a little bit of a background. But from prevention standpoint, I don't think they put enough work into their strength, their plyometric ability, especially like their force absorption as well. They don't understand that at all. So I think that has a massive part in prevention. But the reason why it happens, there's so many factors that it's hard to pinpoint. And I think if I could pinpoint it, I'd be even better at getting more of these ACLs coming through because there wouldn't be any re-ruptures, there wouldn't be anything like that.
Yeah. When you mentioned the idea of force absorption, what do you mean by that, again, in layman's terms, so that somebody listening might be able to target that in their training and prehabilitation?
For me, it's everything comes back to deceleration. So ACLs happen because of deceleration. And if we think in the gym, that's just our landing. So the ability to work what we call going through our tall to shorts or going through drop landings or even when we're jumping, having more of a focus on our landing as well, both double leg, single leg, and in all planes is a massive one for us that we can do in the gym or we can even go through warm-ups out on the pitch or the court where we're focusing a little bit more through, yeah, that landing aspect. There's certain, I guess, templates or programs set up. One's called FIFA 11, which is huge in the soccer world, which is just pretty much a really nice warm up that has shown a massive reduction in ACL injuries just from prepping the body. There's one in AFL as well, and there's one in netball in Australia. But they're pretty much just nice warm ups that are focusing on some jumping, some landing, some basic strength that a lot of athletes do in their warm up, especially the junior athletes.
And when you say deceleration, obviously we're talking about going from a sprint to a stop or going from a jump to a land. And when you're talking about programs that train that, other than like jumping off of boxes or bleachers or whatever, is there any low-hanging fruit people can incorporate relatively easily into their warm-ups that they can add?
Anything related to quad strength as well, because your deceleration is your quad strength. So it could be a wall sit, it could be some split squats, it could be a step up, could be a single leg squat. But anything that loads and unloads the knee like it's going to in a deceleration or a land is exactly what we're looking for.
And when you say that some of these programs have shown a reduction, how do they do those studies? Because ultimately, what's the cliche? You can't prove a negative, right? If it's not happening, is it because of that or is it just correlation?
Yeah, you're spot on there. You're spot on. I'd have to look into exactly how they implemented it, but yeah, FIFA 11 would have been done with multiple younger athletes, and for what they studied, it showed that there was a reduction in ACL injuries potentially across these seasons or whatever it is. I'd have to look into it, but yeah, I'm with you. I'm with you. I don't think they solve everything, but there could be a start. There could be that low-hanging fruit, but I think there's so much more to it, and that's the reason why the ACLs are still happening. If they were simple as that, they wouldn't happen. You know what I mean?
Yep. What's a general timeline and some variants on these recoveries? Obviously, the person you work with that we both know has had multiple injuries, multiple approaches, multiple outcomes. But like, I have a kid who essentially tore his ACL a month and a half ago,
Mhm.
basically wasn't playing as much, but didn't know it was torn,
Yeah.
had a bucket handle tear of his meniscus that caught when he made a strange move just trying to help out like the middle school soccer team, which then led to an MRI that's, oh yeah, your ACL is gone. And it's like, how can that even be where it's torn and you don't even know it versus the ones where it happens and right away you're like, oh, that's gone. Can you give me a background on kind of the varying degrees of injury versus recovery repair?
Yeah, it's interesting, hey, how some people do their ACL and they don't even know. Some people even go out and continue to play, and then it could be a month or so later that they're like, oh, something just doesn't feel right, and then they end up getting a scan and they end up going for surgery post that. It's copers versus non-copers. Copers are people that can don't need an ACL and they can handle it. There's structures surrounding the knee, or the rest of their structures surrounding the knee, holding them in place, and they've probably got enough muscle to do that as well. But then on the other side, you've got people that it could be the exact same thing. It's just a pure ACL injury. But as soon as they do it, they drop to the ground. There's a lot of swelling. They're in pain. From then on, they have a lot of instability. So that's just more the structure of their knee, potentially the psychosocial part as well of how confident they are with going through these certain injuries. But yeah, that's what at the very start. If they go through rehab and they end up getting surgery, which not everyone does go for surgery, our older athletes may decide, okay, I don't want to go for surgery and I just want to get healthy and play with the kids. I just want to be able to run and gym. But if people do decide to go for surgery, we're very criteria based, which means you've got to hit all this criteria to get back to sport. But normally that's between 9 months. For someone that, for us, that's pretty quick. That's progressing really well, and they're probably in a higher level. But then that can push out to 12, 13, 14 months, depending on how that person's going, if they've had any hiccups along the way, what they've done throughout that season as well. If did they go on a holiday with their family that's going to slow them down, or have they just progressed really nicely and stayed locked in the whole time? That means they're probably going to progress a little bit faster.
All right, I want to pivot back and then come back to this. But when you say somebody's a coper, meaning they can deal without having an ACL, how is that even possible? Like,
Yeah.
I don't get that. And I have a colleague who's had a torn ACL for 25 years. He still surfs, he still does all this stuff. But educate me. I think about it like when you just fall down anytime you try to cut left or right.
Yeah, it's interesting, isn't it? Yeah, a copa just means the structures around the knee, the muscles around the knee, the proprioception's able to come back a little bit quicker. Those people can just handle it. And I think there's a mental aspect to that as well, where they're able to handle it. But yeah, there's just copas that their knee is strong enough, their structure surrounding that ACL is strong enough, their meniscus is able to do all that job and really allow them to get back into everything. Some people can get back into absolutely everything. They
Like
can, they
full sports. They can play basketball, football, whatever, no ACL.
yeah, like there's people, I reckon there's people in every pro league. There'll be people in the NBA, there'll be people in the NFL that surely don't have ACLs. Potentially they need to be strapped up a little bit more and be supported a touch more, but they can get through their sport. Copers, there's not there's not heaps of them, you know what I mean? It's not everyone that does their ACL. All right, let's try and be a coper because let's see. It's a special type of person that's able to handle this and can continue playing their sport. And there might be something 5 years down the track. Okay, they have an episode, but for that 5 years, they were able to be a coper and they were able to get their sport in and go from that. It's a challenging one to do, but some people can do it. But most people find out throughout that journey, if they try and be a coper, that maybe they're not a coper. It's a little bit more unstable. They're not confident something does happen, and those are the people. Okay, they're going to go in for surgery.
Yeah, so if I hear you right, you can't just like mentally decide to be a coper. Like your physical structure has to be in alignment with it, your muscle mass, all of that has to align. It's not just mind over matter.
No way, yeah, yeah. And it's a little bit more of the unknown as well. You don't know if someone's going to be able to handle everything with no surgery compared to surgery. So most of the people that we work with, because they're younger athletes, they'll end up going surgery because they want to have a long career. And the unknown part of trying to get through this, which can lead to wasting a bit of time if it does end up buckling. And if it does buckle, there's probably something else that's going to get injured, like the meniscus. So that unknown part is for most people, okay, I want to stay away from that. And I want to, if they're young enough, I want to go into surgery. This is interesting too in Australia. There's also the cross bracing method that's come out in the last year or so, probably a couple years. It's run by, well, it started with two guys in Sydney. One was a orthopedic surgeon, the other one was a physio that went in to be a doctor. And for a certain ACL tear, if you put them in a position that's going to allow it to heal, the ACLs are healing by themselves as well. So it's more a proximal ACL tear with the synovial membrane still around it, I'm pretty sure. But if we put it in a 90-degree position, and they're stuck in that 90-degree position for the first 6 weeks and they slowly allow it to come out. There's a whole protocol for this on the cross bracing method. That ACL can heal. We're not sure exactly how well like it heals, but there's a lot of studies coming out on this that a lot of people in Australia definitely are starting to trial if it is the appropriate ACL tear.
Interesting. And meaning when you say proximal, meaning it's not complete. It's like a partial.
No, it's a complete tear, but proximal to top end.
Okay, got it.
Yeah, the top end of the ACL.
Okay, you also mentioned criteria-based recovery that in Australia, a quick recovery is 9 months,
Yeah.
but we have pro athletes coming back in 6. Talk a little bit about that. The way it was described to me at one point was their window is so short that they just don't care if they tear it again because they got to get back to get a check. But I'd be curious to know what your take is on that.
Yeah, it's interesting. I feel like we're a little bit more, even in the pro sector in Australia, we're definitely more conservative. Like you don't see someone coming back in 6 months unless they're getting into the final series, and they've done an extremely good rehab the whole way. So yeah, I definitely feel like in the States and other countries, like it's so quick that sometimes I'm like they're set they're set up for failure a little bit sometimes, potentially, if they haven't ticked every box and they haven't allowed this person to be extremely well prepared, especially if it's not in the pro sector. Pro sector can do that because sometimes they're genetic freaks. They're so good at what they do. They understand their body so well. So that can happen. But for us, it's like a 9 month, even in the pro sector, that's really good because they're ticking off every single box. They're allowing their ACL to continue to heal, their proprioception's coming back, their strengths where they need to be, their jumps where they need to be, their change of direction mechanics are spot on, and they've integrated well back into their sport. And for us, yeah, a quick one can be around that 9 months.
Now, based on the type of surgical approach, how does that impact their both recovery and long-term prognosis? Because I know there's a bunch of different cadavers, there's hamstrings, there's quads. Can you tick through each one of those in your experience with them? How they differ, why they choose different approaches? Like, what's your take on that?
Yeah, so we probably use three main grafts in Australia. The most common one still is hamstrings. So they take some of your medial hamstring, so your inside hamstring, and a little bit of your adductor, so your groin, and that becomes your new ACL. The biggest thing that comes with that is you lose so much hamstring strength. It's like getting the worst hamstring tear you can get without getting surgery for it. And now we've got to rehab an ACL, but we've also got a really bad hamstring that we've got to try and strengthen. We've lost a tendon through there. We've got to try and regain so much strength. That comes into play when we're starting to really get out on the field and hit some top speed. So if I got a male athlete that got a hamstring graft and they can get up to 30 to 35 kilometers per hour, different over there, I don't know exactly, but we got to make sure that hamstring is so spot on, or they're going to start to re-tear their hamstring potentially. So that's what we see with the hamstring graft.
Is that usually on the same side as the ACL tear? Or they take
Yep.
it from the other side. Okay.
No, same side.
Okay.
Yeah, yeah. If it's their first, it will be the same side. If they've done their ACL on the same leg again, they potentially might take their hamstring from the other side. The graft is the hardest part, so we've got to prepare the graft so well. So with the hamstring, we've got to get that strength going so early. We've got to progress that through the whole rehab, and that's our focus from there. We still got to work everything else, but there's always that graft dominant stuff or graft specific stuff that we've got to work on. The second most common one we see in Australia is probably quads. Especially in Melbourne, we see a lot of quad grafts, but they're done more on our bigger athletes, more males than females. Someone that can handle that quad really losing so much strength. The hardest part early on in any ACL rehab is get the quads firing, but now you've got your quad tendon taken, and now that's even more challenging. So that's called inhibition, where it's the inability for that muscle to fire. So in a quad rehab, we got such a big focus on trying to get that quads going and building a strength through there that with inhibition, the inability for that muscle to fire can be quite challenging. Biggest thing out on the field that comes with that one is deceleration. Like I talked about before, quads are so important for deceleration. So if your quad's not set up appropriately, once we get out on the field, acceleration is going to feel all right, but the ability to stop is the hardest part. Sorry, that's the part we're focusing on there.
And then beyond that, hamstring and quads, do they do the cadaver stuff like we do here? Like what's
But not as much. The probably third most common is your patella
okay.
tendon, so your bone patella, which is a lot more common in the States. But here we normally see them for their second. Like if they've done their knee again, they might go on to patella. And the reason why I think surgeons don't like that in Australia because it creates so much anterior knee pain. The front of the knee really flares up with those ones if you don't do it well. If you do it well, it probably responds very similar to a quad where there's a lot of inhibition, deceleration's hard. But if you don't load them appropriately, for example, one of the boys at our place went on holidays for a while, came back, and his first session back or first week back, he pushed too hard, and then his quad tendon flared up, or his patella tendon, sorry, flared up, and then we had to settle him down and get him going again. At Allografts, we don't use as much. So those three are autografts, and allografts are more cadaver type stuff. Allografts aren't really used too much in Australia unless it's someone that probably isn't going to get back to sport and they just want to get a healthy knee. Or I had a endurance motorbike rider who had to get back in. This is a quick one actually, had to get back in 4 months and they used an allograft for that to get him back on the bike and be able to do endurance-based stuff, but different to your pivoting and you change your direction.
The allograft piece? So I've had like cartilage allografts,
Yep.
not what is that? Tendon? No,
Yep.
ligaments. What's the difference between doing cartilage allografts versus tendon or ligament allografts?
I think like your ACL is such a important structural ligament. So if you're putting in something that's probably the body may reject it, it might not be as structurally sound compared to or structurally strong compared to your quad, your hamstring, or your patella. Like I think we think that if we're getting back to a cutting, deceleration, pivoting sport, like you want to have the most structure and strength around that knee as possible. And that's their main focus there is to have a really strong supportive knee.
Interesting. Are there, you mentioned the cross bracing method, which isn't surgical per se. Are
Yep.
there any new surgical techniques that people are deploying over there or even globally that you've found coming into your office? You're like, oh, wow, I haven't heard of that before, or anything along that pathway?
No, not recently. Probably that cross bracing is the newest kind of thing that's coming in with ACLs, where that's not really focused on surgery, but that's focused on really good healing. From a standpoint in Australia, probably quads are getting done a little bit more in Australia than they used to. It'd just be more hamstrings. But no, there's nothing huge that's new at the moment.
So, to your knowledge, then they've, for all intents and purpose, mastered the approach to doing this. And then on the back end, your area of expertise is taking care of the post-surgical recovery.
Yep.
Is there anything that you've found, let's say over the last 6 to 12 months that you've developed that you're trying that is different from what you once did that has shown positive results?
I think the biggest thing over the last couple of years is making sure they set their foundation up better. I think a lot of rehabs can be rushed and they just want to get through that initial phase and then get them back to running and that type of stuff. So I think the biggest thing that I've noticed over the last couple of years is if I get that quad pumping early by using muscle stimulations, by using blood flow restriction, by pushing them through the correct exercises, getting all that swelling out, getting their walking, getting everything set up, then the rest of it runs really smooth. So that's probably something that people are using more. If you want to talk about that, is blood flow restriction and also talking about like complex muscle stimulation. And I can dive deeper into that if you want.
No, please do. I know what blood flow restriction is, but I'd love to get a synopsis of that. But the second thing you mentioned, I've never heard of that.
Yeah, yeah. So if we talk about your complex first, which is your muscle stimulation. So as I said before, there's a lot of inhibition that comes post these surgeries where those quads don't fire. It's hard to get stuff going. So we put muscle stim. We put muscle stim on athletes where we set it up on their quads and we pretty much just get that muscle contracting by itself with the muscle stim. And that builds that connection from the brain back down to that muscle, creates that pathway a little bit stronger, reduces inhibition so that can fire. So we use that a lot. And we get to the point with that is I want that to be painful on the athlete where it grabs so much that muscle is just firing by itself without that person even having to squeeze. So that's our muscle stim or our complex that we use really early.
Oh,
And the
wait on
other,
that for a second before you pivot.
yeah,
I think that was part of like her recovery over the last session where that quad wasn't able to fire. Is that part of the reason you guys do that?
yeah, 100%. So it's so interesting. People can go through a whole rehab where they're not really thinking about is that quad actually firing? But if you ask them the question, they're like, oh, I've never really felt that quad burn. Like I haven't felt that burn again in that muscle. And that's what we call that inhibition or arthrogenic muscle inhibition, where it's the inability for that quad to fire with basic exercises. That could be a leg extension that's isolating the quad, but they don't feel it in there. So we've got to find ways early to get that going. And that muscle stim is the first thing we use to get it going, to try and get that burn back. So for all my athletes, especially quad, I'm trying to get that burn back as early as possible because if I get that back, then I'm starting to set them up for a strong foundation. Yeah, spot on.
Perfect. And then you were going to go to the second piece about the blood flow restriction.
Blood flow restriction. That's partial restriction of a muscle. We use that for the quad. So we put it up a little bit high, just below the groin, and we pump it up to a point where there's partial occlusion, which means the blood can flow down into the leg. But when it comes back up, that venous return, it pulls around that quad area and creates more of a metabolic overload than a mechanical overload. So you don't have to lift heavy weight here. We just got to do a lot of reps. So for example, it could be a wall sit or it could be a basic body weight squat. And with that, we're getting such a burn through that quad because of that metabolic overload that we can start to push this person with bodyweight exercises to get results that will potentially start to feel when we start loading them up. So we use it early on to get that muscle going without having to add a lot of weight because they can't handle weight. And it will set them up for that time when they are able to handle the weights.
And how do you feel that like the blood flow restriction training works once you've established that baseline? Because I know that people use it not just for recovery, but for traditional training as well.
Yeah, we use it more later down the track for traditional. If they've had, let's say, a history of tendon pain or something like that, we'll go through their warm up with a little bit of that blood flow restriction. But for me, always for my key lifts, if I can get it off, I'll get it off. I don't want someone to be addicted to the blood flow restriction, but I like them to use it for purposes of warming up or whatever it needs to be.
Interesting. Any other new modalities that you found to improve healing?
I guess nothing to improve healing of the ACL, but just preparing the knee even a little bit more. We're probably getting more into deep tier plyometrics too. That could be something else, which for me, it's like the hardest thing in an ACL rehab is how do we load and unload the knee? The athletes don't like to bend the knee. So they want to stay in a stiff position. If they go into their deceleration, they're probably a little bit taller and stiffer. If they go into their landing, they're always a little bit taller and stiffer. Change of direction, same thing. So I think we're always thinking, how can we get him into deeper positions that that knee can tolerate? A simple thing we go through a lot now is just pulse work as well. That could be like on a small box, just doing like a split squat on a small box to just load and unload, but work in a pulse manner to reduce that inhibition as well. And then get them to the point where they're doing that at a split squat or a lunge jump or anything that's focusing on a pulse or an alternating, but starting to get deeper and deeper. And if we prepare that early enough, that's when I feel like, okay, if we get out onto that field, that inhibition's gone and they're good at the movements I want them to see.
Interesting. You mentioned earlier that the copers, but also just in general on the rehab, part of it is mental. Like, how much do you see that as inhibitions to growth and improvement where people are just afraid to do what you're asking them to do?
Huge. It's massive. And that's where I've got to be a really good educator and a teacher and talking to them from the early days. Again, I'm lucky I see these people 2 to 3 times a week. So I can have a really good dialogue and get really good trust with these athletes. But I've got to educate them as early as possible that, hey, this is all right. This is normal. This is what we're going through. This is what you should be expecting. But for some people, it's really hard to break through that. And that's where we get sports psychologists involved and we have them in as early as possible to help with some anchors and start to learn from that aspect. But if I educate appropriately and the combination of probably that sports psych as well, that's what I think is super beneficial throughout this rehab. But yeah, that mental side is so big and probably the biggest driver to for them to be getting held back.
Yeah, fascinating. What's your take on knee braces as part of a recovery and or stability slash preventative? Because I know that you get different takes over here, and curious where you're at as the expert in the space.
That's probably a huge difference, I reckon, from the States to Australia. Is everyone returning to sport, or every one of my athletes returning to sport isn't wearing a knee brace? And if they're returning to sport for knee brace, they probably don't have enough confidence in their knee. And I haven't done a good enough job to prepare them for that. Yeah, I definitely, and I don't know anyone that really in Australia that will use a knee brace for their athletes when returning to sport. Knee braces are used for us more. Let's say that buckle handle tear that you're talking about before, when that gets repaired, they're going to have restrictions for the first 6 weeks of how much range of motion they can have potentially, or how much they can put weight on the floor. So that's more when we use a brace, but that's the only time I'm using a brace. As we go through, I want that brain to understand how good that knee is. As we just talked about, this rehab is so psychological. It's a brain injury, not just a physical injury. So I need them to be so confident through that leg and have the best pathways going through that leg to return to sport. And I feel like if we've got a brace there, we've got something there, the brain's always knowing that we've got an injury that we've got to protect.
Interesting. How would that apply? I'm going to get away from your ACL area for a second. You take
Yeah.
like ankle sprains and things like that, or taping. What's your take as a physio in regards to the ankle?
Yeah, that's an interesting one as well because that's an area that's taped up so much and braced up so much that most people are doing that. Sometimes even if they haven't had ankle injuries these days, are just are taping and bracing just to prevent. If someone's had multiple, then I think, okay, maybe taping through that's not a bad thing. But for everyone else, I think we've got to work more on an ankles. I really like working barefoot as well. I do a lot of barefoot type stuff to build that strength through the calf soleus complex, ankle complex, but trying to get that person as strong as they can through their ankles to prevent like stuff like this happening. But I guess the biggest thing I see in basketball too is if they do their ankle a lot of the time, especially for the first or second time, they're going to be landing on someone's foot, which is a very challenging one. And more of, if we talk about ACL injuries for a second, it's like a contact injury, you know what I mean? They're hard to prevent. So sometimes these ankles are also hard to prevent because there's feet everywhere and you're coming down and we're going to sometimes be landing on them.
Yeah, and I guess it's more from the standpoint of it's inevitable that you're going to roll an ankle. Like it
Yeah.
just is. It's not inevitable that you're going to tear your ACL. But in regards to almost the psychology of the post ankle injury, would you recommend protocols or things to get them back out there quicker, but also to get them psychologically confident that no, this isn't just going to happen again? Because you
Yeah.
definitely I have athletes that are so paranoid about their ankle that like you touch them wrong and it's, oh, I sprained my ankle. And it's like, no, you didn't. Like, it's okay. So give me a little bit on that. It's not directly ACL related, but it's definitely psychologically related to injury.
Yeah, I reckon you're spot on that. Yeah, I'd want those athletes yeah, I'd definitely want those athletes to be progressing back onto the court and back playing without having to tape. But I'd be putting a lot of work into their ankle work, into their plyometric work with the ankles or ankle dominant stuff. Like I'd be putting a lot of work into that so they are building the confidence. I think that would be a massive thing for me. And then continuing to have that stuff in the program, which should probably be there anyway. But yeah, I'd be working on that side to build that confidence, to build that psychological aspect. So when they do return to sport, they're fine to go. But I feel like it's so challenging with basketball players because every other person will take their ankle. It just pushes people into, oh, I've got to do this. But I think if we educate them appropriately and get them going through that, we can set them up for more success and having more confidence in what they're doing too.
So, if I'm hearing you in regards to, let's say, preventative training in medicine, what level of joint stability work would you prescribe rather than just traditional weight training?
Yeah, I'll put them through absolutely everything. Like I want really good, I guess, stability, proprioception. If you think about the proprioception is the main one. Once you injure a ligament, the proprioception, the ability to know exactly where your ankle is in space is lost. So it's finding ways to improve that through a lot of balance work, a lot of vector type work where we're getting in all different positions, and a lot of plyometric work as well. If that's pogos, ankle dominant pogos, landing based force absorption stuff. So I'd put a lot of focus on that, but you got to make sure they have the underlying foundation as well. They got to have over 2 times body weight in their calf work, both standing and seated. Soleus is a massive one for us too, the seated calf, just because that helps out so much in our deceleration, our landing. So I want that to be really strong as our foundation, and then all the neuromuscular proprioception stuff comes on top of that with our landing, our balance, our different positional type work. And I think bringing all that together is more of that preventative type style rather than just being purely strong.
And how much work do you do with patients slash athletes slash humans that isn't post injury? That it's like to what you just described. Actually, I'm working with this guy. He's a pro. I'm gonna make sure he doesn't get hurt.
Yeah. So that's more like I work in an environment where we've got our physiotherapists and we've got our S&C coaches. So for all our athletes, once they get to a certain point in their rehabilitation, if they've passed the criteria or getting close to criteria they need to tick, then they push into S&C environment. And that's when it turns into more of your traditional training with a little bit of rehabby stuff involved. But yeah, we have people that are just coming in for S&C, which work with the S&C, or our rehabbers that finish with or graduate from rehab, they'll go into the S&C environment as well. But that's probably the most important part. If I can keep someone going after a rehab and keep them strong, or just getting someone coming in to stay strong, like they're the most important parts for me.
Yeah, interesting. Interesting. All right, what did we miss? I feel like I just got a deep dive into all things physio and exercise science. What did we miss? What did we leave off? Other advice you have for people?
I think that probably the biggest thing, especially in these long-term rehabs, is create an environment that's going to set your athlete up for success. And I feel like that traditional model in Australia and probably in the States too, where you've got your client for 20, 30 minutes, like you can't set your athlete up for success. So for us, our biggest thing is spending a lot of time for athletes, the ability to be in the gym for all sessions with them. We have a community. So we have 2 or 3 ACLs in each session we have. Everyone gets to know each other. This is their team away from their team. So I think that's the biggest like takeaway for me to talking to anyone is setting up a really good culture or structure that allows these people to have a team when they're away from their team because their identity is their sport. So we got to keep that going for a lot of these athletes, both in the gym, but we spend a lot of time out on the field or the court with people as well. And that's where injuries really happen. They don't happen in the gym. They happen back out on the court or that field. So the biomechanics and understanding how to get someone to accelerate, to decelerate, to change a direction, then getting a ball involved is that's missed a lot as well. So having that whole successful environment is the most important thing to these long-term rehabs.
Love it. We didn't get into the remote work you do, but if you give me like a 5 second version of that and then where people can find you, because this is something that happens a ton here, and I'm sure people would want to be in touch if they can.
Yeah, so I was seeing so many people in the clinic, but I was just starting to get messages through of, can I work with you, but I'm in this state or I'm overseas or whatever. So I created just an online ACL rehab where it's through Radliff Rehab, Radliff_rehab. And what it is, I go through the exact same stuff that I do in person, but we do it all online. I write programs up for my athletes. We have calls once a week. They send videos through. When testing's done, we find a facility that's closed that's able to do very similar testing, and we run through this whole rehab, just like we're having a call each week and making sure that they're staying on top of stuff. So it runs really smoothly if I've got a motivated athlete that really wants to get back to their sport.
Yeah, I love that. So I will make sure we put that in the show notes. Appreciate you jumping on today. It's been fascinating. And when I get back to Melbourne, we'll definitely have to get together.
Definitely have to get together. I appreciate it.